So I think my main message in terms of the fact that this is LFS, or Li-Fraumeni Syndrome Awareness Month, is that while many of us in the medical community and even in the public community think of LFS as a very rare disorder, a rare syndrome that predisposes a very few people to cancer, we know in fact that everything we've learned from working with our families, working with our patients, and studying this disease has opened the doors to a much better understanding of cancer generally, which is critically important. So not only is it important to understand Li-Fraumeni syndrome so that we can improve the lives of patients with Li-Fraumeni syndrome, but also so that we can improve the lives of all people with cancer. My piece of advice for any newly diagnosed patient or child of a parent is there is hope. There are advances happening constantly. There is a huge surge in research in several areas. One is in early diagnosis, so picking up tumors early, and we know that if we pick up cancers early, the outcomes overall are better. There are new exciting areas that we're starting to understand how to manipulate the p53 gene and its protein, which are the root cause. And once we've figured that out, then the whole context of preventing cancer or being able to cure them outright will happen. So if I look back in the last 30 years, I guess, that I've been doing this, there have been significant advances, not every day, but at least every several years. And these are huge steps. I think the time between major advances, the interval between major advances is becoming shorter and shorter, so that you as a new patient or your child as a new patient has even more hope for a great quality of life and long quality of life, even more than those who might have been diagnosed 5, 10, 15, 20, 30 years ago. So the things that we in the field were able to do 20, 25 years ago are almost primitive compared to what we can do now. And I know that 5 or 10 years from now, we'll look back on what we're doing now and saying, okay, what were they doing? Because it will be completely different then. So yeah, looking forward, the sky is bright. So with respect to the LFSA Canada chapter, it is incredibly important that we use this to develop a network so that families, so that children, teenagers can learn from each other, support each other, and recognize when new things come along that they're learning and they're taking advantage of that that sort of platform, if you will, to bring people together. So that's one incredibly important piece, because that's something that's very difficult for me to do. Yes, I'm involved in lots of things and committees and study things, but I'm not really aware of where everybody is necessarily unless they are referred to me or unless they come to me, and they're all right across the country. So that's where the chapter can be incredibly important, is actually providing the glue, the links to allow us to better understand where people are and then engage them and inquire and explore whether they might be interested in taking part of some of the research studies that are going on. So those are the two pieces. One is to enhance engagement in research, which is really what we need to do to understand this disease. And the second is to allow families, people to really engage with each other where they wish and learn from each other and be strengthened from each other's experience. Because many of the questions, we come up with questions that we want to explore to better understand, but some of those questions are actually generated from interactions with you, with other families, as what's important to you. And so we need to kind of keep those communications open. And I think the network through the association is a great way to do that. mean, the one wish would be that we come up with a way to prevent and cure the disease. Period. End of story. My wish would be that I can retire and no other patients would need my services. I mean, personally, I don't think I need a legacy, but that's not why I do anything that I do. It's really not the purpose. But I know what you're asking. I think that when I when I look back, even when I look back now, I say, okay, I've been very fortunate to be in the right place at the right time, and perhaps coming up with some crazy ideas that were not really accepted even by our colleagues, because they were a little bit too far out there, but have changed the way that patients and families and frankly the researchers and physicians think about LFS. And so I think if my legacy would be, if I think of what I'd like to do, it would be for people to think way beyond the traditional walls of asking questions in hereditary cancer, in cancer research generally, because that's how we're going to get closer. We tend to stay too close to traditional ways of thinking. And what I have learned by doing this, and I think the surveillance protocols, well, two things: genetic testing of children with cancer, with Li-Fraumeni syndrome or in a family with Li-Fraumeni, and developing the surveillance protocol are two examples of things that were basically not accepted to be done. And so if there's a legacy there, the legacy is that, if you think that something's right, you go out and make it happen. Going forward, I think the next step that we're really close now on is the introduction of using blood-based biomarkers as a tool for early detection to complement and then perhaps even replace all the surveillance which the Toronto Protocol entails and all the challenges with that. And then the third piece, and hopefully I'll be still working at this point, is when we actually come up with a way to prevent the cancers in the first place. I think that's the way that the teaching has to be, that we've been in a great position to train some terrific people here. You've met them over the years, and there's at least another one or two coming we have for 2023, but 2024. So that's going to be an ongoing thing. And absolutely, if we can have these folks gradually or more than gradually spread around the world, that will be amazing. The other thing, which I think, actually I didn't add this, is we were the first to develop a pediatric-based cancer predisposition program, cancer genetics program at SickKids. Really, there wasn't anything like that in the world. Most of it was done through oncologists or through the adult programs. And now, really, almost every major center in North America and many in Europe and the UK have these set up. Even in Asia, South Asia, places like that, they're setting these things up. And that's really something, because that goes beyond Li-Fraumeni. Li-Fraumeni is an example, but there's many other cancer predisposition syndromes that affect children. And we need to really teach people that these kids can't be managed entirely by an adult kind of focused approach. It's very different. So I think that the model that we developed here, it's not perfect and we're continuing to evolve it, but it's really an exemplar going forward. So it's amazing. I mean, it's fun now to just be able to get together people and saying, yeah, all those programs developed out of the one that we were fortunate to get support to develop at SickKids. The last part of the legacy, if you will, is, back in November, one of my young women with Li-Fraumeni who'd had more than one malignancy and had survived, came to the hospital with her little newborn baby. So as you know, we've talked about this. That's why we keep on doing it, because the good days or the good moments or the exciting moments and the successes definitely, the highs are super high, and those were what keep you going.